The following feature presentation contains educational material dedicated to train the clinical staff at Optimus Healthcare.
Influenza management in Optimus Healthcare. The influenza virus, commonly referred as the flu, typically circulates from the late fall through early spring. Although most infected people have no serious consequences, for others the flu can be serious. The impact varies depending on the year, virus type and subtype, and age group. For instance, the infection rates are highest in children, while the complications, including hospitalizations and deaths, are commonly seen in the people with chronic medical conditions, the elderly, newborns, and babies up to 2 years of age. Flu transmission. The flu is transmitted via droplets from infected individuals when coughing, talking, laughing, or sneezing. The contagion occurs when a susceptible person inhales the infected droplets and the virus enters and attaches to the upper airway cells, including the throat and the lungs. Once the virus is in the body, it may take 1 to 4 days, an average of 2 days, to incubate for the person to present symptoms. It is important to keep in mind that adults may spread the virus the day before their symptoms appear and for up to 5 to 7 days after the symptoms begun. Children may spread the flu virus for longer than 7 days. Another way to receive the virus is via direct or indirect contact with respiratory secretions, such as shaking hands or touching contaminated surfaces, and after touching a mucous membrane. Signs and symptoms. The severity depends on the prior exposure to the same virus strain. Approximately 50% of people will develop classic signs and symptoms of influenza. Symptoms usually start abruptly and may include fever or feeling feverish or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue. Some may have vomiting and diarrhea, although this is commonly seen in children. It is important to remember that not everyone with flu will have fever. Treatment. A patient with flu will receive supportive care. Systemic symptoms and fever usually last 2 to 3 days and are routinely treated with acetaminophen or ibuprofen. Caution must be used when prescribing aspirin-containing medications, as they may produce dry syndrome for infants, children, or teenagers. Antiviral medication may be recommended to treat influenza or to prevent the flu. Regardless, it is important to remember that flu vaccine is still the best way to control the flu. Influenza vaccine. Flu vaccine facts. We currently have 3 different types of vaccines: the inactivated influenza vaccine, the recombinant influenza vaccine, and the live attenuated influenza vaccine. These vaccines have proven to be 50 to 60% effective in protecting patients 65 years of age or younger, as long as there is a good match. Additionally, flu vaccines might reduce influenza-related hospitalizations and deaths in adults who are 65 years or older. Annual immunization is necessary because immunity lasts 1 year and the virus strain changes from season to season. Please keep in mind that you cannot develop the flu from the vaccine. As a matter of fact, after the person receives the vaccine, it takes 2 weeks to develop protective antibodies against the flu. Lastly, providers should offer flu vaccine immunization to the patients even after flu outbreaks have occurred. Universal flu vaccination. According to the Advisory Committee on Immunization Practice, every person in the United States who is 6 months of age and older, unless contraindicated, should receive the annual influenza vaccination. Remember, there is no influenza vaccine approved for use in infants younger than 6 months of age. Additionally, the Advisory Committee on Immunization Practices recognizes the following individuals as part of the special focus group as patients who must receive the flu vaccine. And they are patients whose age ranges from 6 months to 4 years and 50 years and older. Patients with pulmonary, cardiovascular, renal, hepatic, neurologic, hematologic, or metabolic chronic disorders. Patients with HIV or who are receiving immunosuppressant therapy. Women who are or will be pregnant during flu season. Patients who are aged 6 months to 18 years receiving long-term aspirin therapy, as they are at risk for developing Reye syndrome after influenza virus infection. Patients living in clustered conditions such as nursing homes, dorms, or prisons. Certain ethnic groups or races such as American Indians or Alaska Natives. Patients who present with a BMI of 40 or more. Healthcare providers. household contacts and caregivers of children younger than 5 years of age and adults aged 50 years or older, or anybody who is in contact with children who are less than 6 months of age. If the person was vaccinated with live attenuated influenza vaccine, he or she should be recommended to avoid contact with severely immunosuppressed patients for 7 days after vaccination. During the flu season, all employees, including clinical and non-clinical personnel, are mandated to comply with the following options. Option number 1. If the employee consents and receives the flu vaccine, the employee will be provided with a sticker to put on his or her ID badge. Option number 2. If the employee received the flu vaccine during the current season, the employee must sign the declination form and provide a proof of vaccination. Then, the employee will receive a sticker to put on his or her ID badge. Option number 3. If any employee refuses to receive the vaccine, the employee must sign the declination form and the employee must wear a mask for the duration of the flu season at all times and while on the clock, even when he or she is not in direct contact with patients and when he or she is at 6 feet of areas where patients are likely to be encountered. In the event the employee changes his or her mind and wants to receive the flu vaccine, the employee may request it at any time and he or she doesn't have to wear a mask anymore. Flu and pregnancy. Did you know that pregnant women can get their flu shot at any point during pregnancy? The flu shot is the best way to protect pregnant women and their babies from the flu. Administration. Although the flu vaccine can be administered with a nasal spray or by an intramuscular or intradermal injection, in Optimus Healthcare, the employees will receive the inactivated influenza vaccine on the deltoid muscle intramuscularly. Adverse reactions. Even though the person receiving the vaccine cannot get the flu from the vaccine, approximately 15 to 20% of all patients who have received the vaccine intramuscularly complain of soreness, pain, redness, and swelling at the injection site that may last 1 to 2 days after the vaccine administration. These reactions are more frequently observed and last longer in patients who receive the vaccine with intradermal injections. On the other hand, less than 1% of patients who have received the vaccine reported non-specific systemic symptoms such as fever, chills, malaise, and myalgia after the vaccination. These symptoms are common in persons who have not been previously exposed to the viral antigens in the vaccine. The symptoms usually occur within 6 to 12 hours of vaccination and last for up to 1 to 2 days. It is important to note that reports indicate that systemic symptoms are just as common when given a placebo injection. Even more rare than the previous mentioned is the occurrence of an anaphylactic reaction. In anaphylaxis, the body experiences an immediate hypersensitivity to the vaccine components after receiving the inactivated influenza vaccine. This is a medical emergency and the patient must receive an EpiPen injection immediately to be sent to the ER. Among others, the anaphylaxis symptoms may include hives, swelling of the mouth and throat, difficulty breathing, low blood pressure, and shock. Contraindications and precautions. The only permanent contraindication is a severe allergic reaction to a prior dose of an influenza vaccine or a vaccine components. Please note, allergy to eggs must be distinguished from allergies to influenza vaccines. Although an egg allergy is no longer a contraindication for receiving the influenza vaccine, Optimus Healthcare has decided not to vaccinate those who have a serious reaction to egg or egg products. We will refer the patients to have their flu vaccine administered by an allergist.
You have completed your training. Thank you.